Pat. I'm just thrilled to be here today to talk with you about all this incredible research you've done on the internal brace. We're just surrounded by years and years of extraordinary research that you've done, from initial safety studies to biomechanical research showing the concept of load sharing, to the all-important clinical outcome data showing lower retear rates. I mean, the research has been absolutely outstanding. I mean, congratulations to you.
Well, thank you, Bruce.
So to start things off, maybe you could just tell us, what exactly is the internal brace?
So for the internal brace, for what I'm using it for, is basically to prevent ACL graft retears. As a renowned ACL surgeon yourself, you know we'd always like to be in a situation where we don't have retears. Pretty impossible, but I'd like to be an ACL surgeon that has no retears. So I had this idea of using the internal brace, which is FiberTape. Standard material has been used in the body at multiple places. For instance, rotator cuff repair for years, no issues. So it's 2 millimeters wide, 1/2 millimeter thick. It's polyethylene suture, fiber wire, which has been used in the knee for meniscal repairs, for suturing grafts for years. So my idea was to use it just to augment and protect the ACL graft, not to replace it, but just to protect it, prevent retears, better for our patients, right?
Yeah.
They get back to sport, don't have to worry about a re-injury or missing more time. Financially, don't have to have further surgery. And as you well know, revision ACLs never do as well as a successful primary. So for me, it was all about avoiding graft retears was the concept that started this whole journey.
Well, that's great, Pat. I mean, one of the things that people always talk about is it a synthetic ligament? We know from the history that synthetic ligaments have had terrible track records with massive inflammatory response in the knee. So how is this different?
Well, that's a great question, because that's been one of the pushbacks presented to me on multiple occasions. So, like you've been around a long time as I have, and
Thank you.
I've lived through that age. My fellowship with Dr. Houston back in 1985, we put Gore-Tex ligaments in human patients as part of this study. And it was a total disaster, as you know. And then I ended up going to Columbia, Missouri, to start my practice in 1986. A surgeon there had done them. So I spent about 3 years cleaning up multiple inflamed joints with multiple synovectomies. So it's a disaster. This is not a device like the Gore-Tex was, or like Lars is, or like the LED was. This is suture, so it's totally different. Again, it's not replacing the ACL. It's just to protect as an augment. Totally different.
Well, that's wonderful to hear, Pat. We know there have been thousands and thousands and thousands of cases all around the extremities using the FiberTape with little to any reaction whatsoever. So with that, let's go back in time to the very beginning. Walk us through the genesis of like your first safety study.
Well, again, I wanted to prove it was safe for my patients. So I happened to be at the University of Missouri, and I was able to work with the people at the vet school there. So the first study we did was back in 2016. Let me show you that one. And this study, what we looked at, Bruce, was used a quad tendon allograft in a canine model. Canine model is very good for human ACL. It's a double bundled structure. The problem in the canine, as you know, is they have high tibial slopes greater than 30 degrees, which is why if your dog tears the ACL, they don't do an intra-articular reconstruction. They do either a slope leveling osteotomy or an extra-articular sling procedure. So I had this idea, what if we used an internal brace and did an ACL reconstruction actually in the dog, would it be effective? So we did a quad tendon, we had 10 animals, we put the quad tendon in, all inside technique, just like we would do in humans. We followed them with the vet school. We found no difference when we compared the reconstructed limb to the normal limb in terms of range of motion, function, stability. So really it was a pretty amazing study because we showed up to 6 months, which is 2-year follow-up in humans, that the graft stayed intact despite that huge
the slope.
So I thought the IB made a difference there.
Well, that's impressive. So that's quad. What about the patellar tendon grafts, Pat? Any data on BTB?
Well, I'm glad you asked me that because we did have another study here, which we did with quad versus BTB, because as you know, BTB is considered the gold standard. Quad's coming on strong. So we were interested in that. And what we actually found in this study, again, canine model, it worked with internal brace, but what we found is actually the quad tendon was better. We had less inflammatory problems in terms of arthritic development. No problems with use of the IB, but it was actually a better graft for the animal, the quad versus the BTB.
Interesting, wow. Well, I know this, but please share with us one of the landmark papers clearly documenting the issue of the inflammatory response. Because no matter how many times we talk about this, we still get asked the question, even though we know the FiberTape is inert. So walk us through that study.
Let me pull that one up for you too. So this one was the last one, because again, I still would hear, okay, Pat, you're putting in an artificial ligament. No,
Sure.
I'm not. But what we did is we went back to the dog model. We had 6 animals, Bruce, and what I did, we put the tapes across the ACL intact very carefully. Didn't want to touch any synovium around the ACL, kept it intact.
Okay.
6. And I thought, why don't I cut the tape in 3 of them? Let's say it's the worst case scenario. So we cut the tape in 3 of the animals, followed them 6 months, again, 2-year human follow-up. Histology, synovium was normal. Articular cartilage, no problem. So this study, I think, was really important to show that even cut fiber tape, there was no reaction in the translational model in the canine.
Wow, so it's just hanging out there in the joint.
Right.
And no reaction.
No reactions, correct.
All right, so back to this early translational safety data. Can you just sort of like summarize and give us a takeaway of what you learned from those landmark papers?
Well, number one, that using fiber tape in the joint, in the canine model, we had no problems. There was no inflammation, no problems with the articular cartilage or the synovium. So I felt this really showed that it was actually safe to use. And then we had the efficacy data, especially with our quad, that actually was strong enough, I think, because of the IB, to counteract the increased tibial slope in the animal. So it's really pretty eye-opening to see that we actually had the efficacy as well as the safety.
So clearly documented, it's safe. You've also documented efficacy. Congratulations again on some initial groundbreaking research on this.
Thank you, Bruce.